Hi, I'm Dr. Todd Fergus, interventional cardiologist from Green Bay, Wisconsin. Welcome to another brief cardiology overview. Today, we're talking about palpitations. Now, what are palpitations? Now, palpitations is just a fancy word for being able to feel your own heartbeat. Generally, the heart is beating 60 times a minute, 80 times a minute, 100 times a minute, and you don't feel it at all. But some people are very much aware of their heartbeat, and that is called palpitations. Now, what can cause palpitations? There are normal things that can cause palpitations. There are abnormal things that are benign that can cause palpitations. And there are abnormal things that are not benign that can cause palpitations. Now let's start with the normal things. So one normal thing that can cause palpitations is something called sinus tachycardia. And that is just a fast version of the heart's normal heartbeat. So when you're exercising or in pain or anxious, your heart will just naturally go fast, and that is called sinus tachycardia. Some people are particularly aware of their heart going fast, and so they may feel that, and we would call that palpitations. Now let's talk about some of the abnormal things that are benign that can cause palpitations. So these are very common things such as PVCs, which stands for premature ventricular complexes, or PACs, which are premature atrial complexes. These are benign extra beats. So in PVCs, that's where the ventricles just decide to fire off an extra heartbeat in the middle of the electrical cycle of the heart. Or PACs is where the atria decide to just fire off an extra beat in the middle of the electrical cycle of the heart. These are generally benign, but can be very annoying. They generally do not require treatment, but some people are particularly bothered by these extra beats and thus would warrant treatment. Or if people are having a ton of these extra beats, then they may require medical treatment, whether they're symptomatic or not. Now let's talk about some of the abnormal heart rhythms that are less benign. So these are on a whole spectrum, ranging from the much less benign things like SVT, which stands for supraventricular tachycardia, and then the very dangerous end of the spectrum like ventricular tachycardia or ventricular fibrillation. So SVT is an abnormal electrical circuit which can cause the heart to go 150, 170, 190 beats per minute. This can be dangerous in that it can make someone potentially pass out, but generally isn't going to be a fatal arrhythmia. That certainly can cause palpitations when your heart is going 180 beats per minute. And then at the middle of the spectrum would be arrhythmias like atrial fibrillation and atrial flutter. We did a whole video on atrial fibrillation earlier, but this is an abnormal irregular electrical circuit, which also generally is not life-threatening, but can potentially lead to strokes. So it does require specific treatment for stroke prevention. And then at the very more dangerous end of the spectrum, ventricular tachycardia, ventricular fibrillation, these are generally arrhythmias that have to be treated and can be very dangerous or even fatal if they're untreated. So how do we work up someone with palpitations? Well, the first step is just to take a history. If someone says they feel their heart is pounding every time they get anxious or nervous, well, that's probably sinus tachycardia, not something dangerous or anything that needs to be treated or probably not even worked up any further. Or if someone says they notice they have hard heartbeats when they lie down at night or occasional skipped heartbeats when things are quiet and they're not thinking about anything else, that's probably the PACs or PVCs that we talked about earlier, and again, probably don't need to be treated at all unless they're particularly bothersome. Or if someone says that they're having runs of minutes or hours at a time of rapid heartbeats or irregular heartbeats or it makes them dizzy every time it occurs, well, that might be something more like SVT or atrial fibrillation or atrial flutter, and again, probably warrants further workup. So how do we go about further workup besides just taking a general medical history? Well, the first step is to try to catch what the heart is doing on a monitor. And there's several ways of doing that these days. What we traditionally would do is order something called a Holter monitor. And that is a heart monitor that's stuck to the skin and can stay there for 1 day, 2 days, 2 weeks, and records every single heartbeat for up to 2 weeks and allows us to see exactly what the heart is doing at the time of their palpitations. Alternatively, if someone's only having palpitations or dizziness or fainting spells on rare occasions, we can implant a monitor under the skin, and this is something that can stay there for up to 3 years. And then if someone has an episode or a spell, then we can go back and what we call interrogate the monitor to see exactly what the heart rhythm was doing at the time of that episode. Or now in 2024, People have wearable devices that can tell us what their heart is doing at all times. Things like Apple Watches or Fitbits or other wearable devices that allow us to see what the heart rhythm is doing at the time of symptoms. And then sometimes the third aspect of workup for someone with palpitations would be some sort of imaging tests on the heart. We can do stress tests to check out the status of the coronary arteries, or we can do echocardiograms to evaluate for valves opening and closing or heart muscle abnormalities. Because if the heart is structurally normal, then the likelihood of a severe malignant arrhythmia is much lower. And on the contrary, if someone has a structurally abnormal heart, it's more likely that they would have a more significant or less benign cause of their palpitations. And then as far as treatment is concerned for someone with palpitations, that all depends on the cause. If it's something totally benign and normal like sinus tachycardia, that does not require any treatment at all. Benign things like PVCs and PACs, it's completely dependent on how symptomatic the patient is. If they're not having symptoms, we generally do not have to treat those PVCs. If they are bothered, it's keeping them up at night, it's making them dizzy or anxious when they feel it, then we can use medications to try to suppress them. And for some arrhythmias that have more of an impact on a patient's life or activities, we can do procedures such as ablations to try to cauterize the abnormal electrical circuit in the heart that's causing the arrhythmia, that's causing the palpitations, to try to get rid of it more permanently. So in summary, palpitations are simply the abnormal feeling of one's own heartbeat, and there are some normal causes of palpitations like sinus tachycardia. There are some abnormal causes that are benign like PVCs and PACs, and then there are some abnormal causes of palpitations that are less benign, such as SVT and atrial fibrillation and ventricular tachycardia. And the treatment and workup is all dependent on what's causing the palpitations. So that's all that I have for you today. Stay tuned and subscribe to my channel for more videos in the future.